relative to the expectations at the beginning of this year, the level and the impact of COVID has been worse than expected. That impact has been felt most aggressively in emerging markets in Asia, in India and Southeast Asia. But it is important to point here, even though you can't quite see it on this graph, is that the impact that it has had on Australia, Japan, and South Korea remains a big factor, big negative impact on their economies, on their healthcare systems, and continue to affect how our clients and how healthcare companies, pharma, medical device, diagnostics companies are essentially trying to understand what demand planning and what the context of what their operations will look like will be going forward. And again, within that case as well, again, those outbreaks and those disruptions, and again, this gives you a little bit of a clearer sense as well, looking at it from a number of cases in a more per capita perspective. It is that you see the impact, yes, most aggressively around some of the emerging markets, but also that countries that at one point were seen in many cases, such as South Korea, certainly at the beginning of the COVID-19 pandemic, and also Australia, which pursued very much an elimination strategy when it comes to COVID, have been significantly impacted by the Delta variant and by how that is affecting the healthcare environment in Asia. Now, obviously, of course, as you are thinking through, hey, going into next year, assessing the impact that COVID-19 may have around both COVID-19 driven spending as well as non-COVID-19 care. The key point here to take into account when we're looking at these is that the vaccination process across Asia, let's just say, has been a little bit lagged or disappointing relative to, say, many of the other regions around the world. Now, when it comes to developed Asia, we have started to see an improving picture, but one where it is important to note, and again, we'll talk about this here, still a context where we're starting to think about a post-pandemic environment or anything close to a post-pandemic perspective or outlook for these markets. It is important to note that our projections, our expectations is still that these countries are not going to be able to achieve before the end of the year the level of herd immunity that they would want. Again, we expect that it's better than many other markets in the region, but we do expect Australia, Japan, and Indonesia sometime in the middle of next year to achieve that level. But what does that mean, obviously, in terms of, say, how to plan ahead of that moment, is that basically COVID-19 will remain a big factor, both affecting the economy and affecting the healthcare sector more broadly. That is a key kind of fundamental assumption that healthcare companies have kind of already have started to place within their 2022 planning. Now, more generally as well, obviously this has implications as we look through one issue, which again, for business executives managing healthcare, pharmaceutical, medical device diagnostics companies, when can they expect to go back into these markets? And we see here kind of a mixed story. Obviously, the expectation is by early next year, Japan and Korea will at least see some opening with some evidence of vaccinations, again, some level of vaccine passports as Japan is working on, while Australia will take longer to open up. Again, this within a context where many other markets across the region will remain in a condition of still facing and confronting COVID-19. And obviously, if we're trying to think about what does that mean for the healthcare sector, the economy more generally, out-of-pocket spending demand, government funding priorities, let's just say this remains an ongoing concern. Now, what is this kind of pivoting back before we focus on the healthcare sector here? Obviously, the dynamics that we have just talked about around COVID, around global demand to a certain extent, have had an impact in terms of our forecast. One thing to note that at least when compared to many of the markets around Southeast Asia, you see kind of a more mixed picture, as in South Korea, our actual forecasts have ended up increasing or improving over time with the growth of the global economy and the global economic recovery, while other markets, a market like Australia has seen a growth path let's just say, somewhat significantly impacted, although still in positive territory relative to the expectations at the beginning of the year, while Japan essentially has met more or less so far our expectations for growth. Now, again, that's 2021. What about 2022? What is the expectations here? And let's start with Japan. Again, this is to give you a little bit of context before we head a little bit deeper into the healthcare forecast expectations, really were some of the inputs for demand planning in healthcare. Now in Japan, obviously one of the key dynamics here is that it was very severely impacted by the volatile COVID-19 situation, more than anything actually by the response to it that the population had from a patient fear perspective. And the level of recovery has remained, and our expectations remain for 2022 to be relatively subdued, despite significant government financing investment. Again, still a dynamic where most of the policy dynamics here are towards an improvement normalization. It is just going to be a gradual process, which again, still impacted by the potential yo-yo effects of future additional COVID-19 outbreaks. Again, outlook for Japan marred consistently by this, by its own economic challenges as well as COVID-19. South Korea, again, entering into an election year, and we'll see, Julie will talk a little bit about that going forward into the discussion later. Again, the dynamic here is very much one of a continued economic rebound, but one where, because of the base effect after the very strong recovery, or relatively strong recovery for its market, we expect some level of subdued growth. Again, this is in spite of the government's significant expansionary fiscal position, which has at least some implications for the healthcare sector that are worth discussing. And it is also obviously the question around the vaccination process, which has, let's just say, been somewhat of a challenge this year and will continue to be a key issue topic as we go forward. Now, again, South Korea's story, still a broadly positive story. And Australia is not necessarily one that is going to be a very different story. Again, its growth path may not have been as strong as initially hoped or expected at the beginning of this year, but still in a improving and improved position, and still with a significant level of economic growth going into next year, with investment, consumer spending, government actions generally being positively supportive of growth. Again, we want to see continued progress on inoculation. We want to see some progress around government spending versus against plan, and see where the Australian economy goes. But obviously there is some level of question around China-Australian trade relations and tensions, and what that might have in terms of delaying some level of economic recovery. Now that's the economic angle. Like, obviously when one is thinking about setting targets, understanding what to expect in 2022 from a performance standpoint, from a kind of expectations, healthcare companies are thinking around the timelines for recovery of non-COVID-19 activities. And obviously there is a dynamic where some of the hope this year was that we were going to be very clearly entering into a post-COVID environment. An increasing number of governments are setting themselves up for essentially endemic COVID-19 management. But really the dynamic is, where do we see some level of recovery around procedure volumes? We see recovery around care, around patients coming back into hospitals. Again, a post-COVID environment where some of the timelines, many of them, some of the drivers will be highly positive towards healthcare spending recovery and growth. But it is important to understand that even as we enter this situation, the truth of the matter is we'd love to be able to give you an answer in terms of what demand planning is going to look like, what the pace of that demand recovery will look like. And really the issues is that there are many issues with high impact, low uncertainty, questions around patients coming back, questions around out-of-pocket spending, questions around, basically what patients are coming back and going forward. But really some of our discussion today, not all of our discussion, will focus on trying to think through some of the high impact, high uncertainty factors to think through, which first is questions around the lack of strategic plans to address backlog. lack of budget to address backlog. And again, what we mean by backlog is all that non-COVID-19 activity, some of which is simply rescheduled procedures, some of which is patients not getting screened, not getting diagnosed, care being disrupted from many different forms, but also the dynamic around new variants of concern, which is, again, 2022 is not proving at this point to be any more easily to forecast than 2021 has proven to be, even as, let's just say, relative to 2020, as we'll start to see, the impact on healthcare systems has not been quite as aggressive.